Prior to the beginning of the Civil War, most Americans were skeptical of a doctor's ability to heal them because most doctors did not have enough training. A medical school like Harvard, shown here in 1850, would be much easier to get into back then when compared to today. Unlike admissions to medical schools today, admissions to medical schools before the war was only based on if the student could pay tuition. The medical school curriculum was a series of lectures delivered by the school's professors. The same lectures were repeated the second year of schooling because the professors believed the students would learn more the second time around. Army doctors performed a large number of Civil War surgeries at field hospitals. Because many wounds consisted of gunshots to arms and legs, amputation was the most common procedure. Surgery during the Civil War was risky because many of the operations were unsterile. Surgeons rarely washed their hands or knives and used the same dirty sponges for many patients. As a result, post-operative infections caused high death rates. Most Americans believed that family members were better suited to nurse each other back to health. For that reason, many Americans avoided hospital treatment because they saw hospitals as being for poor people who had no family to take care of them. Before the Civil War, many families were opposed to scientific treatments because they are unfamiliar, new, and painful. The Civil War, with its 620,000 deaths and 10 million cases of disease, pushed scientifically based medical care into American society. When the war began, neither the Union nor the Confederacy were prepared to handle the large number of sick and wounded soldiers. Both the Union and Confederate governments had to create medical departments to accompany their armies. As soldiers gathered in crowded training camps to prepare for the war, many Union and Confederate soldiers were exposed to diseases such as mumps and measles for the first time in their lives. Although these diseases were rarely fatal, they disabled thousands of soldiers at a time, which made large hospitals necessary. Because of the vast numbers of sick and wounded, the officers had trouble transporting and taking care of the huge numbers of soldiers, so many were accused of, quote, official neglect of the first duties of humanity to the sick or wounded. Field hospitals and general hospitals were the two types of Civil War hospitals that were formed. Army doctors built field hospitals near camps and battlefields. These field hospitals were designed for mobility and short-term care and were located in tents or buildings like churches, schools, or farmhouses. Field hospitals such as this Confederate hospital were very prone to disease because so little was known about how infections began and spread at the time of the Civil War. Doctors were basically clueless about how to stop the spread of disease among the men. Soldiers who needed more major, long-term medical care received treatment at more permanent general hospitals. Each ward held about 60 patients and was detached on 3 sides from the main corridor to allow patients to receive plenty of fresh air. Most general hospitals also contained kitchens, laundries, operating rooms, ice houses, and morgues. The men were very grateful for the doctors and admired them. Quote, Dr. McGuire, the medical director, is also a young man of fine talents, and is one of your good fellows that everybody likes, and of course I like him too. Diseases such as dysentery, diarrhea, typhoid fever, and malaria were the main killers of Civil War soldiers. The poor hygiene and sanitation in army camps added to the rapid spread of disease. To help stop the spread of disease, doctors and surgeons started to frequently use disinfectants. This picture shows English surgeon Joseph Lister directing the use of carbolic acid spray in one of his earliest antiseptic surgical operations. Lister was one of the first to use antiseptic surgery and advocated it to his colleagues. This advancement greatly decreased the risk of death from surgeries. The United States government created the U.S. Sanitary Commission in June 1861 to help aid in the cleanup of camps to hopefully slow the spread of disease. Directed by Frederick Law Olmsted, this commission worked to improve camp sanitation and advocated the virtues of clean water, good food, and fresh air. Battlefield injuries accounted for many deaths as well. Transporting wounded soldiers became hard because many stretcher bearers often fled during battle, which stranded the wounded on the field for hours. Trained ambulance corps were created in August 1862 and solved this problem by delivering the wounded to field hospitals. The Civil War Ambulance Corps became the American model for battlefield evacuation through World War I. Army doctors performed a large number of Civil War surgeries at field hospitals. Because many wounds consisted of gunshots to arms and legs, amputation was the most common procedure. Surgery during the Civil War was risky because many of the operations were unsterile. Surgeons rarely washed their hands or knives and used the same dirty sponges for many patients. As a result, post-operative infections caused high death rates. In a letter from the Battle of Chancellorsville, a soldier writes about an amputation to his aunt. I suppose you have heard of the death of Lieutenant Charles Calhoun. He died Sunday morning from the effects of amputation of his leg. His father came down Sunday evening because he had heard of his wounded but did not know he was dead. He seems to be very much distressed. Cyrus Strong was wounded badly. We heard Sunday that he was not expected to live, but have heard nothing since last Sunday. Before amputation, most patients received anesthesia, which was sprinkled on a cloth and held over the patient's nose and mouth. After the surgeon removed the limb, he clamped the arteries and tied them off with oiled silk. Most surgeons could amputate a limb in 2 or 3 minutes. Both Northern and Southern women made huge contributions to the war effort as hospital workers. Before the war, few people recognized the importance of nurses. Florence Nightingale's work helped to change those attitudes, but it took the Civil War to solidify the acceptance of women as nurses. Sarah Barton was one of the first women to work on the front lines. She worked to distribute stores, clean field hospitals, apply dressings, and serve food to wounded soldiers. The New York Times called her, quote, the Florence Nightingale of America. President Abraham Lincoln named Dorothy Dix the superintendent of female nurses in June 1861. Dorothy worked with the U.S. Sanitary Commission and demanded that nursing applicants be at least 30 years old and plainly clothed to help gain respect for the nurses. Approximately 3,200 women served as Union Army nurses during the war. Medical care during the Civil War modernized American medicine. Women's work advanced the professional status of nursing in the United States. Public hospitals were constructed across the country. Because Army doctors recorded and studied their patients' progress, scientifically based medical care slowly overcame the popularity of older medical practices. Most importantly, the success from improved hygienic practices during the Civil War stimulated the sanitary movement in America, improving the health of post-war Americans.